if you don't pay attention to your body, your problems are likely to multiply. And so I underwent a surgery which was done in 1999, and this was the kind of surgery where my leg alignment was changed. And this kind of surgery, which is called an osteotomy, is a very useful surgery only if it is done at the right time. So the right time for this surgery is when you start getting knee pain, and if you have bow legs. So you need to do this osteotomy to correct the alignment of the joint, so that it's like doing a wheel alignment of the car. If you don't do wheel alignment of your car at the right time, you will find that the bearings of the car will wear out. Similarly, if you don't do your leg alignment correctly at the right time, you will find that the joint wears out completely. So instead of replacing your joints, it is much better to correct them and also modify your activity. So I started cycling only after 1999, after correcting my knee, and I realized that I could do much better. So what we need to do is, we need to this talk was basically focused at doctors. I told them that we need to look at the patients more carefully and do a rational treatment of various osteoarthritic problems. So some of the treatment that is being given very often is not rational, it is illogical, it does not help the patient to a great extent. So I will quickly go through my slides because a lot of this is very much scientific. So joint replacement surgery is for older people, it is not for young people. Very often people who are young come to us and say, my joint is hurting, should I get a knee replacement done? But knee replacement is ideally done only when people are 65 and above. If you start doing knee replacement in younger people, you can have severe problems because the joint has to be changed every 10 years or 15 years. And every time you go to operate on a joint and keep on changing it again, the surgery is more difficult and the result may not be as good as the first time. Therefore, joint replacement surgery should be delayed as much as possible, and one must use all other forms of treatment which can prolong the life of your natural knee. So for example, look at this lady. This is a 38-year-old lady, and when she moves, yes doctor, she was told that you continue to do physiotherapy and take tablets. But that will not work unless you correct this alignment. So the leg has to be straightened, only then the knee can survive longer. So the surgery I underwent was called an osteotomy, and that has worked for 15 years now. So from 1999 till now I have been extremely active. Various studies have joint before surgery, part of procedure which will help in joint preservation. And although we know that arthritis is not completely curable, yet we can prevent rapid deterioration of the joint. Okay, and here I am cycling. This is a 800 kilometers tour starting from Bangalore, taking us from Mysore to Ooty to Munnar. And I did it last year. I completed, out of 70 people, only 40 completed. I was one of them. Because I was the oldest of the group, I was given a prize for being the most inspiring cyclist of the group. Look at their problems and address them early. You can really prolong the life of the knee and use the knee properly, having good function.